So, Terry Lynch here, medical doctor, accredited psychotherapist, best-selling mental health author, creator of mental health courses for mental health professionals and for the general public. To coincide with an article that I'm writing for the July 2025 edition of the British Association of Counselling and Psychotherapy's Healthcare Counselling and Psychotherapy Journal, I'm in the process of creating a course for mental health professionals, for therapists, on this same topic, working with people with a psychiatric diagnosis. This course will be available by May-June 2025. There are 4 sections to this course: setting out the current paradigm of the psychiatric diagnoses, the common current understanding of the psychiatric diagnoses. Secondly, a critique of this understanding. Thirdly, the presentation of a trauma and psychologically informed understanding of the psychiatric diagnoses. And the 4th section then, working with people with a psychiatric diagnosis. Between now and the publication both of the article and the course, I will be creating videos, such as this one, on topics that I am covering both within the article and within the course. The issue that I am covering briefly here in this video is hearing voices. An important recurring theme within both the article and the course is that well-trained therapists, psychotherapists, counsellors, psychologists, are far better placed to work with people given a psychiatric diagnosis than they might think. And this is the situation in relation to hearing voices, as we will see. There's a strong psychological and trauma aspect to the hearing of voices. And therapists, after all, tend to be well trained in working with people with trauma. Stand for 10 minutes on a busy city street any Saturday afternoon, watching people go by. You will observe that many people walking alone are so deep in conversation with themselves that their lips are moving, are forming words, are deep in thought, an active inner conversation going on. We each have an inner conversation going on virtually continuously, particularly when we're on our own. That ongoing inner conversation with oneself may be either in the first person, I, me, we, us, in the second person, you, ye, or the third person, they, them, another. Let's start with the inner conversation, the inner voice in the first person. The majority of this inner conversation with oneself takes place in the first person. For example, I need to do this or that. I want to do this or that. I think, I feel, I'm warm, I'm cold, I'm tired, and so on. It's worth noting, as we will see a little later, that an actual sense of self is needed for this to apply. High levels of wounding, as we will discuss in a few moments, diminish or reduce our sense of self. When the inner conversation is in the first person, it tends to be unified. We are in a reasonable state of wholeness. There is some degree of tranquility, at peace within ourselves, to some degree at least. Moving on then to when the inner conversation is in the second person. I personally have often noticed that when I'm frustrated with myself, my inner conversation shifts from the first person, I, to the second person, you, as I'm talking to myself. If I'm not happy with something I've done, this doesn't happen that often anymore, thankfully, but this is the kind of inner conversation I'm talking about. If I feel I've made a mistake or got something wrong, I occasionally still will say to myself impulsively, "You idiot, what were you thinking?" The inner conversation having shifted now from the first person to the second person. I'm talking to myself as a you, not as an I. So I feel that conversation in the second person tends to happen when I'm unhappy with, when I'm judging or rejecting what I said, myself, and I'm turning on myself, judging myself, criticizing myself, giving out to myself. So it's like me giving out to me. So that's the conversation in the second person, as me talking to me, but doing so as me talking to non-me, to a you, to someone else, a second person. Some people have gotten into the habit of talking to themselves as a you on an ongoing basis and feeling quite peaceful and calm about it. But I do think that what I'm describing here is a common theme within people. That ongoing inner conversation with oneself, then, the third person, they, them, etc., represents a further degree of distancing, of separation from the second person, which, as we've seen, is a degree of separation from the inner conversation in the first person. This, as we've just seen, being the conversation in the second person, me talking to me. When the conversation goes into the third person, this changes to this. When our degree of wounding is very high, we may feel that it's much easier, that it takes much less for us to fall off the cliff, to fall into overwhelm, annihilation. So we humans tend to do two things. We make ourselves very small, and we tend to withdraw to a safe place within our space, as we would if there was a major hurricane barreling in towards us. In such a situation, we would go to the safest room in the house. If we had a basement, we'd go to the basement, for example. People in this situation tending to have zero confidence in their ability to do what is necessary, what you believe is necessary, to find solutions, actions, often in day-to-day life, that will meet our needs, that will address challenges we face on a regular basis. For people whose inner conversation is regularly in the third person, the degree of wounding that they tend to have experienced is so great that their sense of I is greatly diminished, greatly reduced. Therefore, there's little or no I to initiate, to lead the inner conversation with oneself, since the person's sense of agency, empowerment, sovereignty is at this stage greatly diminished, if indeed present at all. Speaking to ourselves in the third person is an expression of disconnection from ourselves, detachment from ourselves, dissociation, depersonalization from ourselves, all of which are characteristic of high levels of wounding, which itself is always a feature within people who hear voices and who become diagnosed with, for example, schizophrenia or psychosis as a consequence. Therefore, what is described as hearing voices in the third person is really not so different to hearing voices in the first or second person. Eleanor Langdon is a British psychologist. Eleanor Langdon was 17 and in her first term studying for a psychology degree when she began to hear a voice talking to her. Within weeks, she found herself diagnosed as a schizophrenic and forcibly confined to a secure psychiatric ward. Eleanor described, "Then one morning, out of the blue, I heard a quiet voice in my head commenting, 'Now she's going to the library.'" She continued, "After that, I occasionally heard the voice again. It never said anything dramatic, and I didn't find it threatening at all." This is an important point. Sometimes the voice was also a useful indicator to me of how I was really feeling, such as the day it sounded angry following a tutorial in which another student had unfairly criticized me. We see here that there may indeed be some purpose to hearing voices, an appropriateness, a rightness to hearing voices, remembering that we all hear voices. But as I mentioned earlier, for most of us, we primarily hear voices either in the first person or the second person. These voices may not be so different, just that they're in the third person. Eleanor Lundgren continued, in relation to the student who unfairly criticized her, "After I returned to class the next day and put my point of view across more forcefully, the voice in my head once more resumed its usual calm tone. This reassured me that, far from being some sinister psychiatric symptom, the phenomenon was probably no more than my own externalized thoughts." Absolutely. just a different way of us expressing ourselves to ourselves, experiencing ourselves and expressing ourselves. But then, she said, I made the fatal mistake of confiding in a friend. I will never forget the horror in her expression as she backed away, repeating, "You're hearing what?" when I mentioned the voice. Up to this point, Eleanor wasn't making much of the voice, wasn't alarmed by the voices at all. Her friend looked really scared and told me I needed to see the college doctor as soon as possible. So her friend, a fellow psychology student, immediately, without a second thought, pathologized the hearing of voices. So she went to the doctor. The doctor's face became very serious at the mention of the voice, and he insisted on referring me to what he called a hospital specialist, who turned out to be a consultant psychiatrist. Eleanor continued insightfully, "What I wanted and needed was to talk to someone about my feelings of anxiety and low self-esteem, low sense of self that I referred to earlier, since I had arrived at college. But the psychiatrist kept emphasizing the significance of the voice, as though we were discussing a mathematical formula in which having this experience automatically meant I must be insane. Even when I talked about my work for the student television station, which was work that she was doing at the time, I could tell from her face that she thought this was fantasy, the hearing of voices rendering her words untrustworthy in the eyes of the psychiatrist. Think of how demeaning that is for the person." Eleanor continued, "I felt I walked into that room as a normal, if slightly stressed and vulnerable young girl, but left it labelled with a diagnosis of a paranoid schizophrenic, my interest in broadcasting dismissed as delusional. Even at that first meeting, the consultant was already discussing with me the possibility of inpatient treatment at a psychiatric hospital." In both this article and in her TED Talk, Eleanor Longden continued to describe how horrendous her next few years were. In and out of psychiatric hospitals, believing herself to be very seriously ill because that's what the doctors told her, so medicated, so drugged up that she couldn't think properly, couldn't focus, greatly prolonging her journey through her psychology course. A few years later, she came under the care of a different psychiatrist, a Dr. Pat Bracken, in Bradford, in Britain. I've known Pat Bracken for years. We were in college together. Pat is an exceptional psychiatrist. Pat and I have been colleagues in seeking to change the mental health paradigm towards a trauma and psychologically informed one. As a psychiatrist, Pat is an exception, certainly not the rule. In our meetings with Dr. Pat Bracken, we talked about the voices, and he suggested that I stop seeing them as a symptom of mental illness and start looking at them as a way of finding out about myself. As I mentioned, Pat Bracken is an exceptional psychiatrist. There are very few psychiatrists who would speak to their patients in this manner. Most, like our first psychiatrist, once they hear that a person is hearing voices, the conversation changes completely. The conclusion is made that you are clearly seriously mentally ill, and that's now the springboard from which all interventions and all care evolves. Not with Dr. Pat Bracken. She continued, "This encouraged me to tell him about my first experience of the female voice. Up until now, everyone had treated me as if I was completely passive, but Pat showed me a way of helping myself to get better." Over the next few months, she attended Pat Bracken for regular weekly sessions, gradually reducing my medication until I stopped the drugs completely, with his guidance. During this time, I discovered that if I engaged with the voices, they became less frequent. I also learned to challenge the more threatening voice, refusing to do what it told me and telling myself it was no more than a symbol of my own externalized anger, a very accurate way to interpret this voice. One by one, the voices gradually disappeared, until I was only occasionally hearing one. 3 years on, at the time this article was written, in 2008, I am healthy, happy, and perfectly stable. Schizophrenia is a frightening and misleading label which stigmatizes people. While the doctors insist I was schizophrenic, and in medical terms she met the criteria for schizophrenia, I don't know if the label really applied to me. We could actually say the same about the vast majority of people diagnosed with schizophrenia. The experiences and behaviors are very valid, but this does not necessarily transmute into the presence of a medical illness called schizophrenia. I think, like many young people leaving home for the very first time, I was stressed and unhappy. Going to university and the lack of support there tipped me over the edge. Exactly. She became overwhelmed, and hearing third-person voices were an expression of that overwhelm. All I ever did was hear voices, something which she initially felt was quite benign, until her friend, the college doctor, and then the psychiatrist concluded that her hearing voices was a very serious medical situation. She continued, "Now I have learned to deal with them. I am now studying for a doctorate in clinical psychology, as well as working on the medical team that helps teenagers suffering from the sudden onset of psychosis. I often wonder what would have happened to me if I hadn't found a psychiatrist who understood how to treat me." Really, the psychiatrist Pat Bracken understood how to see her, how to respect her, how to accompany her on her journey towards healing and recovery. If I do hear a voice now, I'm no longer frightened because I understand why it's happening. All human experiences are purposeful, including hearing voices. My mother's signal for knowing she's stressed is an attack of migraine. Mine is the voices. That's a very good way to put it. Maybe not such a huge deal after all, the huge deal that the psychiatrist made it out to be. Eleanor London has also created an excellent YouTube TED Talk entitled "The Voices in My Head." She created this video in approximately 2014, which was 9 to 10 years later. In this video, speaking of her sense of self around the age of 17, leaving home for the first time for university, she said, "Appearances, of course, can be deceptive. And to an extent, this feisty, energetic persona of lecture-going and traffic cone stealing was a veneer, albeit a very well-crafted and convincing one. Underneath, I was actually deeply unhappy, insecure, and fundamentally frightened. Frightened of other people, of the future, of failure, and of the emptiness that I felt was within me. Trauma, wounding, distress, wounded and reduced sense of self, all fundamentally psychological rather than biological issues." She continued, "But I was skilled at hiding it, and from the outside I appeared to be someone with everything to hope for and aspire to. This fantasy of invulnerability was so complete that I even deceived myself, some of the time at least." When people reach a point where they are regularly hearing voices in the third person, that happens because they've been very traumatized in their lives and are very overwhelmed. Eleanor London makes some references to this in her video. She said, "Many people have harmed me in my life, and I remember them all, but the memories grow pale and faint in comparison to the people who've helped me. But together, they, the people who've helped me, forged a blend of courage, creativity, integrity, and an unshakable belief that my shattered self could become healed and whole. I used to say that these people saved me, but what I now know is that they did something even more important, in that they empowered me to save myself. And crucially, they helped me to understand something which I'd always suspected, that my voices were a meaningful response to traumatic life events, particularly childhood events, and as such, these voices were not my enemies, but a source of insight into solvable emotional problems." 100%. The voices took the place of this pain and gave words to it. And possibly one of the greatest revelations was when I realized that the most hostile and aggressive voices actually represented the parts of me that had been hurt most profoundly. And as such, it was these voices that needed to be shown the greatest compassion and care. Isn't that so insightful and so beautiful? How right she is. Eleanor London eloquently expressed the reality that hearing voices is purposeful. Another purpose that I have seen to people hearing voices on many occasions is that these voices can diminish loneliness. For a person who, for example, has become so wounded that they find interacting with people out there in the world overwhelming and consequently withdraw to protect themselves, hearing voices on an ongoing basis can literally be like company, a way of passing the time, a way of passing the day. All human experiences and behaviors are purposeful. As therapists, I'm recommending to you, you probably do this anyway, but what I'm saying is that this principle also applies to the experiences and behaviors that come to be diagnosed as psychiatric diagnoses. All human experiences and behaviors have a rationale. There is a rightness to them. There is a purpose and meaning. If you've enjoyed this video and if you'd like to know more about my upcoming course on working with people with psychiatric diagnosis, then please feel free to reply to this video, message me, make a comment, and I will let you know when this course is available, which I expect to be by May, June 2025, if not before. Thanks for watching. Have a great day.